Or, so let me see here. What ELCOR provides is education to terminally ill individuals and the public about their legal end of life options, specifically medical aid in dying and voluntary stop eating and drinking, which the acronym is VSED. Um, we also educate healthcare providers so they know how to refer and when to refer clients and how they can support their patients through the MAID or VSED process. One very important thing we do is we help find participating doctors and pharmacies. Many clients come to us and their doctors are not able to participate in Death with Dignity because they're affiliated with a religious healthcare organization like Providence or Adventist, or they're VA physicians. Death with Dignity is not a federal law, so those VA physicians can't participate. And then we will support the client and family all the way through the process, including attending their planned death if they would like us to be there. So, right now, some of the choices for end of life care, one thing that's missing from this slide is just stopping treatment. You do not have to enroll in hospice if you stop treatment, but we strongly encourage all of our clients to enroll in hospice. And over 90% of our clients are enrolled in hospice and are often referred by hospice. The two options that ELCOR actively supports are medical aid in dying or MAID. Some people use that synonymous with death with dignity, and then voluntary stop eating and drinking. So, right now, there are 14 jurisdictions that allow medical aid in dying, um, 13 states plus Washington, D.C. And you can see on this map there are other states that have legislation in a proposal state. There are some states where it's being challenged, and right now we're working on a couple amendments to make Oregon's Death with Dignity Act a little bit more liberal. So the eligibility for medical aid in dying, this is probably the most important slide in this series. Someone needs to be an adult. They need to have a 6-month terminal prognosis by two Oregon physicians. One's called the attending or prescribing physician, the other is the consulting physician. And these must be MDs or DOs. They must be mentally capable of making healthcare decisions. And this is probably the most critical criteria on the slide. They must be mentally capable at the time they qualify and also the time that they take the medication. And sometimes people become ineligible because they are no longer mentally capable. They submit 3 requests for medical aid in dying for prescription to end their life. 2 of those are oral requests that are made at least 15 days apart, and one is a written request. They must be able to self administer the medication. So, in other words, we volunteer can hold a cup or glass up to someone's face, but we cannot pour the medication in their mouth. If we are, the client has a rectal administration or administration by feeding tube, we can pull up the medication in the syringe, place the client's hands on the syringe. What we cannot do is apply any pressure. So that's self-administration. Now, I will say that we have been extremely creative in some cases about this self-administration criteria, and it's never been a barrier. We've always been able to figure out some creative way for a client to self-administer. It's interesting that only 2 states currently will allow out-of-state residents to receive MAID support. That's Oregon and Vermont. And actually, we've even had a couple clients from outside the U.S. Medical aid in dying is not considered suicide or assisted suicide. So, medical aid in dying is used by a terminally ill patient who has a 6 month or less terminal prognosis. And that death certificate says the cause of death is the underlying illness. For example, pancreatic cancer, COPD, congestive heart failure, whatever. Suicide is considered by someone who has the choice to live beyond that 6 month terminal prognosis. It's actually considered a mental health issue, and the death certificate certifies suicide. So, why is that important? There's often a stigma attached to suicide. Somebody doesn't really want their death certificate to read that. Also, very importantly, many life insurance policies will not pay out for suicide. The other option that LCOR actively supports is voluntary stop eating and drinking, or VSED. Now, VSED is legal everywhere in all 50 states, and provides a peaceful death. Hard to tell exactly how long that will take, typically 1 to 2 weeks, but it can stretch out to 3 weeks. Even the smallest amount, drinking even the smallest amount of liquids can increase the time to death. This is a more difficult option because it really requires, after the first couple days, 24-hour care. The client becomes very weak, incoherent, needs a lot of support. Again, legal in all 50 states. And the typical client who would choose VSED instead of MAID is someone who has a chronic illness but does not have a 6 month prognosis. So, for example, someone in early stage Alzheimer's or dementia, or someone with a chronic neurological condition like ALS or Parkinson's. That is the gist of what we do. May I answer any questions?
That there were some questions in the chat, but it sounds like they were mostly answered. Looks like we maybe have just 1 more minute. Francesca's asking, is your service free?
See, I don't. Let's see. Oh, MAID, MAID is medical aid in dying. Okay, someone's answered that. Should we don't know. Second acronym is VSED, voluntary stop eating and drinking. I'm sorry, what is IHS? What about IHS? I'm not sure what IHS is.
Okay. I think that
Is there a cost associated with the service?
Not our service. All of our volunteers, including our physicians, are free. We do certainly accept donations from clients and families, and let them know about that choice if they appreciate the services that they get. I will tell you the medication itself, the final medication, is quite expensive. It can be up to $875 currently. The only insurance that covers that is Medicaid. Kaiser patients end up paying a little bit less than that, but yes, it's expensive. And someone asked about what about IHS? I don't know what IHS is.
they ended up saying, I think Indian Health services, but Jane, I would love if you could answer some of these questions in the chat. I think that would be
Okay, yep,
awesome, and then we can move
absolutely.
on. Awesome. Thank you so much, Jane. This was
Thank
super
you.
interesting, and sounds like people would love your contact information too. So thank you so much. Okay, next we have Stacy Hurst from Multnomah County. You ready to roll, Stacy?
I am.
Perfect.
Hi, everyone. My name's Stacy Hurst. I work for Multnomah County Adult Protective Services. Let me just get my screen. Is that showing as the full screen or is just like a little slide?
Just a little slide right now.
All right, I'm trying to. There we go. I think. Oops. All right. Yeah. Hi. So yeah, I work for Adult Protective Services, and I'm here today to talk about Adult Protective Services, what we do, and how we can be a resource to your organizations. So what is Adult Protective Services? Our goal is to provide protection and intervention for older adults and folks with physical disabilities who experience abuse, neglect, and self-neglect. We are a voluntary service, so folks have the right to accept or refuse our services. Basically, we're just going out and offering different resources to try to reduce whatever kind of risk or harm that's happening in their life. Who can we serve? We serve any adult over the age of 60 in Multnomah County. Other counties, it's 65 plus if you're in a different county. Any adult with a physical disability, or any adult living in a licensed care facility, so assisted living, residential care, adult care homes, and so on. Some of the things that we investigate, physical abuse, verbal, emotional abuse, financial exploitation, sexual abuse, abandonment, wrongful use of a restraint, involuntary seclusion, and also neglect of a caregiver. So if you're working with a senior or someone with a physical disability and you hear something like this going on, you can reach out to us and we will work with that person to try to reduce whatever kind of harm's happening in their life. We also investigate allegations of self-neglect. So what does that mean? That means that there's a person that has an inability to understand the consequences of their actions or inactions that's leading to harm or putting them at significant risk of harm. So what we're talking about here, it's not someone making choices that maybe we don't agree with. It's someone that has some sort of cognitive impairment, maybe like dementia or traumatic brain injury, that's making it so that they can't understand that they are causing themselves harm. So in these cases, we're going out and we're just offering different resources to try to, make sure that person is able to live safely in their home. Sometimes someone might choose to move to a higher level of care, and we're happy to help them navigate that process. But even if someone is experiencing self-neglect, we still don't have any sort of right to force the person to do anything they don't want to do because they're adults, right? I mention this because I think in some ways it's a good thing. I hope that it makes it more welcoming for folks in the community to give us a call when they're worried about someone, knowing that we're not going to force anyone to do anything about it. So just keep that in mind. So what happens during one of our investigations? So basically what we're going to do is we're going to go out and gather information. We're going to speak with that individual to see what's going on. We'll obtain any sort of documentation as appropriate. We can get medical records. We can help the person get their financial records, things along those lines. And then we're going to assess the situation. We're going to determine what kind of safety risks this person is facing. And then we'll work with that person to decide what kind of steps they would like to take to reduce whatever risk of harm is happening in that situation. And in order to do that, we work very closely with our community partners to provide resources to the individual and connect them to things that they need. So we are happy to help people navigate all sorts of different resources, food resources, caregiving, navigating, applying for Medicaid, you name it, we can do it to help that person remain safe. So how do you make a report of abuse or neglect? You can give us a call. Multnomah County APS, we're open Monday through Friday, 8 a.m. to 5 p.m., 503-988-4450. And you'll speak with one of our screeners who will basically ask a whole bunch of questions to determine, is this person eligible for services? And Is the situation rising to the level of abuse or neglect? If so, that'll get assigned for investigation, and then our investigator will go out either the same day, the next business day, or within 5 business days to talk to the individual and try to see what we can do to try to help. If you're calling for someone outside of Multnomah County, we have a statewide hotline, 1-855-503-SAFE, 7233. I also like to remind folks too, we're not an emergency service. So if you feel like someone is in immediate danger, you want to go ahead and call 911 first. But after that, you can give us a call and let us know the situation, and we can see if it's something that we can assist with. So thank you so much for having me here today. I also wanted to put it out there that I do outreach to different community groups. So if you're interested in having a more in-depth session about adult protective services and mandatory reporting, I am happy to do virtual or in-person trainings with folks. So just feel free to reach out to me, and I'd be happy to chat about what your needs are.
Awesome. Thank you so much, Stacey. And it looks like you have some questions in the chat that you can
Great.
answer there. And yeah, really, really appreciate the work that you do in your presentation.
Thank you.
Okay, Dryden from Community Warehouse.
Yeah, hold on, just getting set up. Here we go. Okay. All right, everybody. Hi, I'm Dryden. I am from Community Warehouse, and I'm hoping you can see my slideshow there.
Yes, we can.
Let me pull up. Hold on, my computer decided to be wacky. There we go. Okay. So, Community Warehouse is a nonprofit furniture bank. We provide furniture and housewares to anyone in our community. We are here doing elders today, but really anyone in our community can use our services. We provide that furniture to neighbors seeking the comfort and dignity of a furnished home while overcoming adversity. So that is anyone in our community who is experiencing furniture poverty. They do not have to be just coming out of houselessness. They can have been housed for an intimate length of time, but need things like beds, a table, kitchenware, etc. Um, so I kind of already went over this, but what a furniture bank is like a food bank. People give us furniture from our community. So anyone in our community can donate furniture that is in what we call dignity condition. That means no tears, no rips, no dog hair, no, dressers that are on one leg. And we provide that to our community members. Um, so we might already engage with your organization. We engage with 200 referring partner agencies. We are helping families and individuals coming out of those adverse situations. On average, between our 3 locations, which I'll go over here in a minute, we serve about 65 families a week. That's a lot of mattresses, you can imagine. And we serve clients through on-site and virtual appointments. So that could be helpful. Virtual appointments are done through Zoom or Google Meets, I believe, actually now. And so that your client doesn't have to leave their home, or if they have work or whatnot, they can take care of that appointment from wherever they need to. Our impact in 2025 is we served 8,063 people, 91,000 plus items were given away. We diverted 1,300 tons from the landfill, and like I said, 65 families a week. The average donation turnaround time, especially for mattresses, couches, and large items, is about 48 hours. Sometimes it's 5 minutes. Somebody can drop off an item, and then immediately the person who's in the furniture bank shopping can say, I love this. Can I have it right there? So we've actually had things come off of one truck and immediately get onto another truck. Like I said, we have 3 locations, Portland, which probably a lot of you know, Tigard, which is in downtown Tigard, and then our Gresham location, which is about just a little over a year old now, is behind the Rock Haven Climbing Gym off of Gleason and 223rd, or near Clear Creek Middle School. Um, Gresham is only open Wednesday through Saturday right now. Hopefully that'll change with our staffing in the future. But for now, the other two are open Tuesday through Saturday, which means we also take appointments those days. We accept donations through any of our donors. You can drop off at one of those three locations or schedule a pickup. That this is where the prayer part for seniors can be really helpful. If you have seniors that are moving from homes into assisted living or memory care or whatnot, we offer a pickup service for $65 flat rate. We take everything that is usable for our programming. That can help save money on moving costs or junk hauling. Um, so just let you know, also we pick up only in the three metro counties. So that would be Multnomah, Clackamas, and Washington. We don't pick up in Washington State, and we don't pick up outside of those three counties. Um, we uh, and then our staff and our volunteers will process those donations. Some of the things that we are looking for and are providing to our community that are most requested right here, as you can see. Some of these are things that are probably really clear, like queen beds are an obvious thing that we need. But pillows, we get a lot of pillows that are not actually in good use because they have staining on them. We can't give anyone a pillow that has stains on it. Lamps are also a big thing because a lot of housing in our area doesn't have overhead lights. So if you are helping a senior clean out their home, these are the kinds of items we are looking for. And there's a much more extensive list on our website if you are curious. Um, the other piece that we talk about is working with our partner agencies. So some of you might have already been to our warehouse, but what we do is we attend, you do need to attend a case manager training and then schedule an appointment. We offer three options: in person with your own transportation, in person with delivery provided by us, and virtual appointment, which also has delivery. Um, then payments, we'll talk a little bit more about what those are here in a second, but um, you want to make sure that you have payment either set up with our accounting office ahead of time, or you can pay like billing, or you can pay at the time of service. And then just make sure that your client knows what they are expecting. This is secondhand goods. This is not new stuff typically. Sometimes it is, but typically it's secondhand goods. And the staff, the amount of stuff we have and what we have changes daily. So we may not have as many choices some days as in other days we may have lots and lots of choices. Um, an appointment looks like for a client, they get to sign in with our staff. They are greeted in our greeting room. They get 45 minutes to shop the store. They can get large items as well as small things, like we said, lamps, dishes, spatulas, throw pillows. Really popular items can be like food storage containers, that sort of thing. And then everything is packed up for them so that it can reach their home safely. We wrap everything and make sure that it's not going to break on the way to them. Each home costs about $1,500 for us. The average market cost is $6,000, like if you were trying to do this new. But we charge only $150 for an appointment with no delivery and $400 for delivery, depending. So that was the type of appointment. And then in Washington County, if you are lucky to be in Washington County, or clients in Washington County, they may be able to get their appointment paid for through the Supportive Housing Services contract. We are working on Clackamas and Multnomah currently, trying to get those contracts as well. But until then, we do require the payment from our partner agencies. Like I said, it can be about $6,000 if you're trying to buy these items new. It can be about $2,500 if you're trying to do the secondhand, but also the time that this takes to go to Goodwill and Facebook Marketplace and all of that. So community warehouse appointment can save you and your client lots of time and money, just to be able to make sure that they have a place to sleep, a place to eat, a can opener, all the dishes that they need. We just opened direct services, which is a big deal because we have a lot of agencies that have lost funding and aren't sure what to do. So now we are able to have individuals who either don't have a caseworker or clients from organizations that are having funding struggles or limitations on their ability to come to Community Warehouse. It's the same cost as if it is referral, so it's $150 for no delivery or $400 with delivery. The number there is if you're not sure if somebody you're working with would qualify for this, feel free to reach out. And I will send Maren a flyer to for this as well. It's got a value of appointments so that you can give that to your agency if they're not convinced yet, or you can also share it with people. We already talked about most requested items. And then the small touches are really important. So new pillows, like I said, new shower curtains and rings are things we're always looking for. We actually give house plants to people. So if you have if you're dividing your house plants and you have a couple of extras, we'd love to see them. Art is really important to make a home feel homey, and then throw pillows and blankets and rugs can also make a space feel like it belongs to the client. So we're always looking for things there. Ways to help are pretty obvious, but sign up to be a case manager if it's appropriate, donate, volunteer, host a collection drive, invite me to come and speak with you, or you can come shop at our thrift store on MLK and Shaver. All the funds in our thrift store do go towards funding our programming. And then staying connected. We have a newsletter and we are on social media, so feel free to follow us there, and that'll give you lots of information about changes to, if we change the fees, if we have special needs that week, if especially the social media, we had a lot of closures during the heat and smoke, so that can be helpful to know what's going on there. And with that, I am done. So I will stop my share, and then if there's any questions, I'll answer them in the chat.
Perfect. Thank you so much, Dryden. And looks like you do have some questions in the chat and also just some love for Community Warehouse, which is great to see. Okay. Well, we're doing great on time. This was awesome. Next up is Sharon Bliss from Aging Better Together.
Hello, everyone. Let me get my screen sharing. I guess I might owe you an apology because my understanding and the slides I'm showing are the Oregon Warm Line. And the Oregon Warm Line and Aging Better Together are two programs of community counseling solutions. I actually manage both programs. And the Warm Line, how many people here have actually heard about the Oregon Warm Line? Did you know that there is a peer support service that is available at all hours, every day, holidays, weekends, anytime, for people who want to have a peer support conversation, be listened to and heard, and have someone who is curious and engaging explore with them? So that's what the Oregon Warm Line does. And Aging Better Together is actually an offshoot of this program. The Warm Line began in 2007. I joined the company in 2017 and noticed how much of a need for older adults there was in the realm of people who are feeling isolated and lonely, right? So we began a specialized branch of the Warm Line that we now call Aging Better Together, that is specific for older adults who are experiencing isolation and loneliness. And right now we are funded only in Washington County. So it is a wonderful service for folks in Washington County who are older adults and feeling a lack of social relationships and connections in their lives. For folks who don't know about a Warm Line is focused on non-crisis peer support. We are funded by the state as a prevention and early intervention program. We are staffed by people with lived experience of mental health, addictions, and trauma recovery. We currently have 54 individuals working on the warm line. Let's see. The service is free, confidential, preventative in nature. And the idea is that if people have a resource and a place to connect and touch base and kind of sort things through, they can make better choices and hopefully avoid some of the crisis services that are expensive and not always really pleasant to go through those kinds of experiences. So we would much rather maintain contact with people before they reach that level of distress. It's not designed for emergencies. We're not considered a hotline, we're a warm line. But we do, of course, get some emergency suicide or domestic violence calls. We don't provide a clinical intervention. What we do provide is intentional peer support. Intentional peer support is a very specific type of peer support that all of our folks are trained in. And it's about the relationship and about being curious, being open, holding multiple truths, not judging, but actually really listening, validating experiences and feelings, and being present with people so they can sort out what they want for themselves and what they choose to move toward. We're looking for mutual growth. We are not there to advise. People who get into advising get into a little bit of retraining because that's not what we're looking for. The warm line first started in 2007 with just a couple of guys, a painter and a farmer in rural Oregon. I don't know how many of you know Community Counseling Solutions, but it is actually the behavioral health entity in 6 Eastern Oregon counties. Our warm line and Aging Better Together programs are the only CCS programs that are really functioning to serve people throughout the state. Well, I can't say that for. We did at one point have a contract for the older adult program that was much larger, but currently just through Washington County, and really looking for opportunities to grow that program so that more isolated older adults can receive a match who actually calls them weekly and develops a relationship with them over time. So that's a little bit of the difference between the warm line and Aging Better Together. Aging Better Together really matches up older adult peers with the older adults who are lonely, and then they get a call every week from the same person. So really develop a very much more specific and deeper relationship over time. We also offer groups for the older adults, which they have really taken to. It's surprising how many of our older adults in Washington County are accessing Zoom groups for peer support. The warm line was named for David Romphrey, who was an early peer advocate in the state of Oregon. And then, as I mentioned, in 2017, we added the Aging Better Together program to the Oregon Warm Line realm of services. Today, the Oregon Warm Line is offering 24/7 peer support. We've been doing that for over 3 years, nonstop. Amazing. We also have a wonderful group of bilingual, bicultural Spanish speakers who also answer the line, so people can access our line in English or Spanish 24 hours a day. We're currently logging about almost 100,000 calls a year. It comes out to about 8,000. Right now, it's between 8,000 and 9,000 calls a month. Each call is a 20-minute peer support session. Callers who use us regularly know that it's a 20-minute session, and often if people are from Oregon, they get priority, and so they will sometimes call multiple times in a day. What we're offering is, first of all, connection, just genuine human contact, listening, validation, support, a caring ear to hold space for your feelings. Your experiences and feelings matter. We do affirm that. We try to approach each call with curiosity, really like understanding a person's perspective about what they're going through, what they're experiencing, what they need. Our goal is to be non-judgmental and just offer mutual respect. How it works. Intentional peer support is an awesome form of peer support training. We offer it in the training in collaboration with Folk Time that runs the IPS Oregon Hub. Intentional peer support is a method that is used nationally and internationally, and is very relational. The idea of mutuality, that we're not just serving someone. IPS is very aware of power. We're not helping someone because we're not presuming that we know more than them or that we could tell them how to do their lives. We're learning with them and exploring with them. We're curious about how they've come to see the world and what their worldview is. What are they bringing to every experience that's impacting what their experiences are? We believe that challenges provide an opportunity to learn and that people feel valued and learn within relationships. And so that connection is just so important to well-being. Why people call us? Many different reasons. A lot of it is loneliness and isolation when people are stressed and distressed. And believe me, over the last year or two, we are seeing much higher levels of distress. We actually rate each of our calls for distress levels, and what we call a yellow call, which is a sort of a medium distress, has more than doubled in that time. Lots of distress in the community. People having relationship difficulties, experiencing trauma and trying to process that, big emotions, voices, visions, mental health challenges, addiction and recovery, mostly just needing someone to talk to. And in terms of older adults, more than a third of our callers are older adults. So this is a resource that is used by both young and old, but older adults are definitely the largest chunk of folks using the service. 24/7 every day, all this. 44% is the reduction in ER visits among Warmline callers. So we're pretty proud of that. We have we take stats with each call, and we do show a really significant impact on some of the crisis services. Oregon callers get first priority. They can call multiple times a day. And this says no limits, which isn't really entirely true. I need to change this because we can give up to 3 calls, maybe 4 a day. But after that, our staffing just can't handle more calls. But we really do have people who call us every day. It's toll free, it's confidential, no insurance, no appointments, no paperwork. Gotta love that. And the basic messages to people: you don't have to go through this alone. And there is our 800 number. I think I have another image. Yeah, that's our newest image that we're using as a logo. I'm happy to answer any questions. I know I didn't do quite justice to Aging Better Together, but hopefully someday I can come back and talk specifically about that.
Sounds great. Yeah, that's perfect. Thank you so much, Sharon. I really appreciate
You
your
are
time.
welcome.
And you might have a couple questions in the chat. You might have to do a little bit of digging. So apologies about that, but thank you so much for your time.
I am trying to stop sharing, but it's disappeared. Let's
See
see.
if I can.
Funny. Oh, here it is. It was behind all of you.
Great.
There we
I'm
go.
glad you figured it out.
Thank
We're
you.
going to be able to. Okay, awesome. Thank you so much, Sharon. And next we will hear from Kristen Moran from Brain Injury Connections Northwest.
Sorry, I need to turn my audio on. Is everyone able to see my screen okay?
We saw it and then it disappeared.
Okay, hold on one sec. having some mouse issues here.
It's all good. This is part of the monthly learning session, honestly. Little bit of time to figure this out. Awesome. We can see it
There we
now.
go.
Thank you.
Well, good morning, everyone. My name is Kristen Moran, and I am a volunteer with Brain Injury Connections Northwest. And I'm going to just share today a little bit about who we are and then what we do. So, Brain Injury Connections Northwest, or we refer to it as BIC Northwest, it is an all-volunteer run organization. We've been around for about 13 years and provide programs and services that serve people with brain injury, mainly in the Portland metropolitan area, but we do also have a lot of virtual programs as well. And really, our mission is to improve the quality of life for those who have sustained brain injuries. And that includes all brain injuries, from concussions to strokes to everything in between. We right now have 13 programs, and all of our programs are 100% free to all participants. So, brain injury is often very isolating and hard to find appropriate resources and care. Our organization actually started with a lot of people who sustain brain injury themselves, and our board is made up of many people who actually also have sustained brain injuries. And so, really felt a need to bring people out of isolation and into a community. So, our programs are not only educational, but they're really social programs that are community focused and often peer led. So, I want to just give you a quick overview of some of our programs. Art on the Brain is probably one of our most popular ones. And this is where people with brain injuries can explore different media for self-expression. They work side by side with Portland State students. It's a 6-week program that meets weekly, and people can meet in person at our community center downtown. They can also meet virtually. Those two things kind of happen simultaneously, to try to build that community across just the in-person setting. And many people return to this program over and over again. It has a very strong community feel. Our Brainy Bunch program is a peer-led social hour where anyone affected by brain injury, including family members, caregivers, can come. It is our most attended program, and that meets weekly via Zoom. Our coffee social is similar in that it's a very informal, kind of lighthearted way to get involved in the community and hang out with other people who have gone through similar experiences. But we meet in person at our community center downtown. We usually have around 25 people. It's really gaining in popularity, which kind of shows the need for a lot of people needing that face-to-face contact, especially after COVID, to really meet in person and hang out. And we've started doing kind of monthly events as well, and parties around the holidays for this group. We also offer a variety of support groups. So our Brainstormers is a support group that usually starts with a couple thought-provoking questions to kind of get the discussion going. It meets monthly at Emmanuel Medical Center. And this is our probably longest running program. But what is different about this support group is next door we have a friends and family support group. And so this is for caregivers of people who have members in their life or people in their life who have sustained brain injuries. So they take place at the same time and next door to each other. So caregivers and brain injury survivors can go together and then go to their support groups that meet their specific needs. We also have a virtual support group. This is really geared towards more educational guest speakers. So we have acupuncturists, rehab specialists, naturopath, all sorts of speakers come and share resources and explore topics that are related to brain injury. And when we don't have speakers, kind of turns into a regular support group where people can share their experiences and get the support that they need. And that meets twice a month. We also just have a lot of other social programs. We have like a good old-fashioned like board game day where people can play games together. It's our newest program. And it's really just to allow people to build skills while just hanging out with friends. Love Your Brain. This is a program I'm heavily involved in. And so this is adapted yoga. It is taught by yoga instructors, but we have been specifically trained in the Love Your Brain yoga that is a national program. And it's basically a yoga program for people with brain injuries and how to do poses with balance issues and dizziness issues. So we do adapted gentle yoga as well as meditation. And then we have a discussion at the end of class around specific topics related to brain injury and how to really build resilience. So we talk a lot about mindfulness, we talk about building realistic optimism and things like that. We also have classes specifically just for people who need to be in a chair or in a wheelchair. And then we also have classes where people are on their mats as well. Like Art on the Brain, this is a 6-week program that meets weekly and people can repeat if they would like. We also just do events around town. We have a social walk where we do litter pickup at Mount Tabor Park. For those of you who are not familiar with PDX Sunday Parkways, they are kind of free, family-friendly events where city streets are temporarily closed to cars. And so we offer like a walking group and a biking group to go through that parkway. We also have a vendor booth as well there, and that meets 4 times a year. We also have something called the Friends Program, and this is a 6-month partnership with Portland State, where speech language students are paired with survivors, and they have about 2 to 4 conversations a month. We also do a yearly camp out, which is a great experience for many of our participants. We provide all the meals and gear, and it's for not only people with brain injuries, but also their families and caregivers as well. Holidays can be really hard for people who are feeling isolated and alone in brain injury. So we try to do a lot around the holidays, particularly a popular one is a wreath workshop where we use local greens and everyone leaves with a wreath. And again, just another way to build community and have people feel less alone. We also do educational trainings in the community. I'm a part of this as well. One of the ones that we do more regularly is a crisis intervention training for first responders in Clackamas County. So we partner with law enforcement and we provide an interactive presentation on kind of a brain injury 101, what are causes, symptoms, and then what are some de-escalation strategies you can use when working with people in the field. And we are trying to grow our outreach, kind of get the word out on who we are. We're at, we do OMSI After Dark. We've been at farmers markets, different fairs this year to not only reach more people, but also seek volunteers for people who are interested in working in any of our programs or joining our board. There's lots of different opportunities to volunteer. Again, we are all volunteers and are always looking for help. I would say within the past couple years, our growth has really just expanded. We're on track this year for 45% increase compared to last year. We've had over 150 people new this year attend our programs, up to 50 students. We have about 35 regular volunteers and have a very dedicated working board to kind of keep these programs free and available for all who need them. And so for more information, you can check out our website, you can email. If you're interested or know people who might be interested in volunteering, we're always looking for, like I mentioned before, people who want to get involved in our programs or join our board. We do have we partner a lot with Portland State as well as specific universities, so always working with students as well. And that is it.
Awesome. Thank you so much, Kristen. That's amazing
You.
that you're all volunteer led. That's a lot of programming and really, really great resources. So thank you so much.
Mhm.
Stacy's already on it. Next, we'll be hearing from Stacy from AARP.
Hello there. Thanks, everybody. Is that the slideshow version that's sharing?
We see it, but it's like we see the notes area too.
Oh,
So
okay.
we
All
might
right.
see.
Let's see if I can get it to do slideshow. Hello, slideshow. There we go. All right. Awesome. I think that's what I needed. So, hi, everybody. You know, AARP is somewhat well known, but I thought I'd just run through what we are and then talk some about what we're doing locally. We're a nonprofit, nonpartisan. We are a C4. We advocate for the 100 million families and people who are 50 plus. And our tagline or our thing is empowering people to choose how they live as they age. So let's make sure I'm advancing in the right place. How about that? Here's some of what we do. So I'm going to go through what we do in community first, which are things that people may have heard of because we have these programs locally, Movies for Grownups, Driver Safety, Tax Aid. Many different community organizations host our tax aid volunteers. Livable Communities features a grant program that many nonprofits have applied for over the years. That opens in January, February timeframe, typically every year. And we do have lots of online resources and even phone resources. So phone calls, teletown halls that come in a variety of topics like family caregiving, fraud prevention, voting, things like that. So then moving on to what we do informationally or what else you might find on our website, we do have a lot of things around fraud, fraud prevention. Fraud Watch Network is a series of volunteers who are very well trained in addressing the many crimes that are happening around different kinds of frauds that target us all, but older adults tend to lose more money in them when they get targeted. Also, you may have heard of some of these programs of AARP, Wish of a Lifetime. I mentioned TaxAid already, but OATS is one of our very popular programs, the Older Adults Technology Services. So these are all under the umbrella of AARP, and I'm calling from the Oregon State office, which we are the local presence. I thought many people would make this point already, but I thought maybe I better make it myself. America is aging. We are experiencing demographic change. Oregon has already changed in a way that other states have not. So we are anticipating and expecting it to be a permanent change that we have more folks 65 and over than under 18. So we like to think of this as not only a change in society and culture, but also a commercial opportunity. So we talk about it as the longevity economy, and we do talk about the power of the older adult, providing 43% of US GDP, paying the majority of federal income taxes paid. So there's lots of different ways to think about this, but we want the question to be, are we as a society adapting fast enough to these changes? These aging solutions and different things that people might need are a big market. There are products that can help. We've kind of heard of some of them in community-based organizations, but there are commercial products as well. They're currently not enough of them. They're not accessible enough, and they're not usable in the way people need them to be sometime. And we do like to include in this piece that some of the longevity economy means folks are working longer and that those longer working lives need to be productive and not precarious and not influenced by age discrimination or any of those situations. So we are very synonymous with protecting Social Security and fighting for Social Security, which is something that we all earn as we work. So we are all paying for it currently. It is not going away. In fact, the current report shows that in 2021, it will still be paying benefits. So find out more about that on our website. Now I'll switch over to something a little more local. When we talk about livable communities, we mean all the things that help people to age in community, transportation options, housing, the ways we engage socially, public spaces that serve us. So those are some of the things that the grant program addresses and that we advocate for locally at the city and county levels. Just to share a little bit of how we work, and you've already heard it from other folks, but we also engage volunteers quite a bit. They are working with us in advocacy. They work with us for information and education that we provide. And we do member engagement and community service with our volunteers as partners. So I'm just going to dig in one more kind of, I don't know, detailed slides, I'll say, to focus in on what that livable community really means. It means advocating for things in the built environment, like I mentioned before, housing, outdoor spaces, and transportation, but it also means advocating for things in the social environment, the ways that we communicate and include, and older adults can participate and lead social, um, civic and social participation, and again, working longer. So there may be things that people include for employment and also stable retirement, right? And then those health services and community supports, many of which we've been hearing about already today. We advocate for these things to be available. We recently achieved Oregon as a member of the Age-Friendly States Network, and that means that we're making a commitment to make sure that Oregon doesn't arrive and say we're done. We are age friendly, but that we're constantly working on becoming more age friendly. This is my contact information, which I'll put in the chat. And I left a couple of fun pictures. These are our volunteers in action. So this is kind of what it's all about. Some volunteers here. We have outreach. We go to events as well. You might see us around town. We were at Sunday Parkways. And we do have folks of all ages who are volunteers with us. So we do include families, and our membership does start at 18. So that's it for me. I'm going to end this slideshow and hopefully stop sharing. Thank you.
Amazing. Thank you so much, Stacy. Okay, we're doing really fabulous on time. And so we'll have one more presenter, and then after that, we'll be hearing from HealthShare regarding some of the Medicaid changes. And then after that, we can have some open Q&A as well. So last but not least, we'll be hearing from Riley Thayer from Community for Positive Aging.
Hello, everybody. Apologies, I don't do many presentations, so let me just. All right, can you all see my presentation?
Yes, perfect.
Wonderful. Thank you, thank you. Thank you for having me, CSN. Thank you, everybody, for presenting about your awesome work. I'm really happy to be here. My name is Riley. I'm a community health navigator at the Community for Positive Aging. I might refer to it as CFPA for the rest of the presentation. So CFPA, we started as a senior center over 50 years ago. We're located in Northeast Portland. Over those 50 years, we have grown and transformed, and we have brought in some housing services into what we do. So we have sort of two major programs. We have our senior center, which serves people 55 and older, and then we also do our supportive housing program. We want our senior center to be somewhere where everybody can come in and find something that feels meaningful to them. We have all sorts of programming, try to really have it be reflective of community interests and community needs. We also try to have resources that help people live healthy, happy lives. Here's our mission statement. We want to foster a healthier, more inclusive and connected Portland for adults 55 plus. through educational and recreational programming, support services, and care. So our vision includes intergenerational intergenerations. Are people familiar with that term? Maybe hit a, yeah, I see some nodding heads. Yeah, we know that we're stronger together, so we want to build those connections. We want to be age positive, like so many of the other organizations who have presented today. Kind of want to fight ageism, see all the beautiful strengths that come with aging. And we also want to be age inclusive. People who come here can be 55, they could be 102. You know, there's a lot of diversity in the older adult age group. And we really want everybody to just feel seen and welcome when they're part of our community. So sort of at the core of what we do is center programming. Has anybody, I know some people have been to CFPA before, but if anybody has, maybe raise your hand. Yes, great to see you again, Jane. We are a community center. In addition to being a senior center, we're also a resiliency hub. So when the temperatures are over 100, we open as a cooling center and everybody's welcome. And we have different groups come and do like Boy Scout groups here. We have a church that does their services out of here. So we're really a community center in addition to being a senior center. If you check out our website, there's a calendar of events, and we really do have exciting things happening every day that we're open, which is Monday through Friday. And people can also come just to like have a cup of coffee and have a chat with folks. We do try to have virtual and hybrid programming as well. I think that really strengthened during COVID, and we want to keep that up so that we're as accessible to people who live across the region or maybe transportation is a barrier. Welcome them in through hybrid programming. Here's some examples of what we do. That picture is of our Hollywood ukulele group. They're actually practicing right now. They practice every Tuesday. So if you hear ukuleles in the background, that's exactly what it is. We have fitness programming, educational things, and food programs also on Tuesdays. We have Meals on Wheels at noon, and then we have a community food pantry that is open at 1:30. And that food pantry is open to people of all ages as well. One thing we do is information and assistance and our senior support services. So we are a district center with Multnomah County, and so we do case management for people in our district area. People can call and get referrals, get assistance on all sorts of things with our wonderful INA specialist, Katie. She gets about, I don't know the exact number, but dozens of calls every day across the gamut. Some people become case managed, some people just have a quick question, and we really want to meet people where they are. Like I mentioned before, supportive housing is a big thing in our program delivery. We do both permanent supportive housing programming as well as enhanced resident services. So we do different kinds of programs in different buildings. You can see them listed there. A lot of them are downtown, but not all of them. Some of our buildings are specifically for older adults, but not all. Some of them are all ages. So that kind of brings in that intergenerational aspect. One really fun win we just had was we celebrated National Night Out downtown. Alder House and Julia West are apartment buildings right across the street from each other. So we closed off the block and had a block party for the whole neighborhood. It was super fun. Community health, that's my program. We do things like this, build networks, learn about resources so that we can share that with our folks. We also are working with OHA right now on 2 grants. We're working on vaccines and tobacco cessation. That is a really great opportunity for us. We've been doing vaccine work since 2021, and it's wonderful that we are able to continue doing that. And then tobacco cessation, I think we're one of the only organizations who focus on older adults for tobacco cessation in the state. So again, it's a really cool opportunity. I'm going to keep moving. Our food programs, I kind of touched on. We work with the Oregon Food Bank. We have just a ton of volunteers who make the programs happen. We have weekly food pantry on Tuesdays, like I mentioned, and then we also have a couple monthly food programs. One that is very near and dear to my heart is the Asian Food Pantry. It was the first culturally specific food pantry in the state of Oregon. It's a closed pantry, unfortunately. We have a waiting list for folks, but that is for Asian elders, and it's culturally specific food. And it is just a wonderful time. We have over 100 folks come from all over the city and get food and see each other and have like a little social engagement as well as get some great healthy food. Our volunteer program is the heart and soul of what we do. We could not exist without our wonderful volunteers. They do pretty much everything here at CFPA. In this picture, you can see some folks making the Asian Food Pantry happen. And I am very grateful for this volunteer cohort that has been helping the community health program right now expand our program into Washington and Clackamas counties in addition to Multnomah. And I wanted to plug, we have a health fair coming up. Folks are so welcome to come and be participants, or if you are interested in tabling, reach out to me. I would love to hear from you and tell you more about the fair. But it's going to be Saturday, October 10th. AARP will be there. Thank you, AARP. You all are sponsoring our event, and we're so grateful. We're going to have a vaccine clinic, and it's geared towards older adults, but there will be something for everybody. And I think that's it. So thank you so much for your attention. Check out our website. Please reach out to me if you would like to collaborate. And then you can find us on social media as well.
Amazing. Thank you so much, Riley. I love hearing the music in the background. I barely heard it, but it's super sweet to picture. So thank you so much.
Yeah, thank you for having us.
Yeah, and thank you so much to all the presenters. Super, super appreciate your time and for everybody being here. Before we move on to our special segment, I'm just going to put the survey for this session in the chat I know some folks might need to go. So if you could take a few minutes to fill that out before you leave, that would be awesome. And I'm going to pass it to Abraham from Health Share of Oregon to walk through some of the Medicaid changes that we'll be seeing that will likely impact some of the folks that y'all work with. So Abraham, take it away.
Yeah, thank you. Let me see if I can share my screen. Sure, sharing the right one. Okay, can everyone see my slides?
Yes.
Awesome. Okay, so I'm going to be providing a relatively high-level overview of the upcoming Medicaid changes that we're going to be seeing in the next coming year. Sometime after that, we already presented kind of like a really quick summary at the last month's learning session, but I'm going to be repeating some content since I know not everyone was present, but also there's very minimal things that have changed. And that's going to be a common theme as you start hearing more about what I have to share. Introducing myself first, my name is Abraham Rodriguez-Guillen, he, him pronouns. I'm the community engagement specialist at Health Share of Oregon. And it's just one of the groups where we've decided that we want to share some of this content and information. You all do very important work. It's very important for us to really be aware of the upcoming changes. So let's get right into it. Since there's a lot of information to share. So kind of background, why is this happening? Well, July of last year, Congress did pass an HR 1 bill, also known as the Big Beautiful Bill. A lot of you might have seen it on the news, but then coverage kind of died down. So what really is it doing? Oregon's in a very unique position because of our 1115 waiver that we have with the federal government. We are able to delay some of the implementation. So actually, in other states, a lot of the changes that I'm going to be sharing today have already started. So again, the caveat with me sharing this information today is that it's current as of this month, really as of this day. Information is changing quite often, and I will explain a little bit of why that is. But also, if you are serving any members that are outside of the Oregon service area, this information probably looks a lot different. So I wouldn't try to apply this to other systems, especially since Oregon is just really unique. But the big three things I'm going to be talking about today are the non-citizen eligibility changes. There are going to be more frequent renewals, and there's also going to be work or activity rules for some adults. And I'll get into that just shortly. So why is it difficult to kind of talk about what's going to be happening and really release concrete information? Well, number one, it's not all coming at once, which is good because we can prepare for it. So that's kind of how I'm going to talk through the information, is talk about what's happening first. And then I also want to acknowledge that if you look at this timeline, you might also notice that it overlaps with local and state elections, midterms, of course. So there's going to be a lot of different opportunities for basically everything to change. There might be new laws passed, or maybe just the state and local governments will impact what these systems are going to look like. And that is why it's really difficult to say exactly how things are going to be, since there are still like a year to a few months away for things to be implemented. And then just talking a little bit more about our role. So federally, Centers for Medicaid and Medicare released most of their final ruling on the HR 1 bill. Although there is more guidance expected in 2027, but until then, we have the ability to really start implementing things right now. So what happens? Now the state has to really create and develop the systems that are going to be put in place in order to be able to meet all of these requirements that were set by the federal government. And then CCOs are tasked with sharing and delivering that information to our members, kind of why I'm here as well, and really preparing our health systems for these new changes, since there are going to be some things that are going to be actionable and effective at our level. And then, of course, at the provider level, so organizations that are providing direct service, hospitals, clinics, CBOs, community health workers, eligibility support workers, there is going to be a lot of changes in terms of the processes. So if something hasn't come down yet and you are a direct service provider, very likely you might be hearing from either HealthShare or just another channel soon in regards to how that might be impacting how you work with your members. Since a lot of the organizations here really rely on members to have the Oregon Health Plan to be able to take care of themselves and be able to access timely health services. So I just really wanted to break it down of like what's within our level of action. As far as CCOs go, there's a lot of questions of, well, what happens when someone falls off of OHP? Can you do anything to support them if that happens? And the answer to that question is really, we can't really help the member after they have fallen off OHP in terms of CCO. That is because we have all of their information while they're with us, but as soon as they fall off, we lose the information that we have on the member until they get assigned to us again. So we're really, in terms of what we can do, we can really inform the member, we can prepare them, and we can try to mitigate some of these things while they're enrolled as a member, which is why it's really important to try to keep them enrolled and avoid that disenrolling, re-enrolling challenge that we might be running into as some of these changes are implemented. Okay, so talking about what's going to be happening first. So I hope most of you are familiar with the Healthier Oregon program. The Healthier Oregon program is a primarily state-funded program that makes sure that people are able to access full OHP benefits regardless of their immigration status. It's a relatively new program as far as OHP goes, and it's been working pretty well. But the federal bill has some requirements that are actually going to be impacting some members. So the immigration statuses that you all see here, these members are currently eligible for full OHP benefits. So under expiring Medicaid guidance, these members are able to apply the same way that citizens and permanent residents are able to. But starting October 1st, they will no longer qualify for Medicaid under federal rules. But luckily, we have the Healthier Oregon program to kind of step in and take care of these groups of people. However, there is going to be more changes coming starting January 2027, which are going to be kind of impacting how that's really going to look like. So right now, individuals on the Healthier Oregon program are able to access care through their CCO networks, their coordinated care organizations, just like any other OHP member. Unfortunately, that is going to be changing starting January 1st, 2027. So all Healthier Oregon program members, so that includes the previous groups that I mentioned, plus people who are already on the Healthier Oregon program, and they're going to be transitioning onto OpenCard. So what's OpenCard? OpenCard provides pretty much all of the same core benefits that one would be able to access if they were part of a CCO and their network. However, what is different is going to be the provider networks that may not be enrolled to participate with people who have OpenCard. That basically means that they're not set up to bill them. And there's also going to be a reduction in some optional CCO services like flexible services. And then care coordination is also going to look a lot different. We don't know what care coordination is going to look like. Traditionally, people who have OpenCard have historically been on their own in terms of finding providers, making their own referrals, being in charge of their own care coordination. The state is looking to see what our options are in terms of transitioning people off of CCOs and into OpenCard and seeing what we can do to kind of bridge the gap, especially for high acuity members, and then exploring what additional care coordination services can look like after that. But everything is just in a planning stage. And again, there's a lot of different factors that can affect how this is actually implemented. Again, referencing the state and local elections that are certainly going to be impacting the landscape and deciding who is going to be in charge and really leading these task forces that are going to be thinking about these what's within our locus of control. But if you want to take away anything, is that OpenCard, the primary differences are just that care coordination piece and the providers that members are able to access. This is definitely going to complicate things for families who are mixed status, who have households with some citizens who are eligible for full OHP benefits, but then also some individuals that are going to be transitioning onto OpenCard. That means managing two different systems, two different sets of phone numbers. It's certainly going to make things a lot more difficult for people who are part of this group that are going to be affected. And moving on, what is coming after that? So also starting January 2027, some groups of members are going to be required to fulfill work or activity. Just details. So there's going to be a requirement of at least $580 earned monthly in verified income. What does verified income mean? We don't know yet. That's one of the things that we're waiting on OHA to really build out. Or completing 80 hours or a combination of volunteer or education or work or training programs. So This list isn't comprehensive in terms of what qualifies for members to fulfill the worker activity requirement. And then there is something that I want to note. The way that $580 was calculated was by taking the $725 federal minimum wage and then just multiplying it by $80. So in terms of the work requirement, it's not about completing the 80-hour minimum. It's about achieving that $580 minimum. So this can be achieved a lot quicker. Again, it still puts up some barriers in terms of individuals being able to fulfill this requirement, but it's certainly a lot easier than relying on the federal minimum wage, since at the Portland Metro minimum wage is $1680, and then the standard minimum wage throughout most of Oregon is $1555. So members should be able to fulfill the requirements twice as fast, but this is one of the things that makes our state uniquely placed in a better position than other states that rely on the federal minimum wage, is that we are going to be able to have our members meet that requirement much sooner. In terms of how this really works with the combination, so let's say that a member works enough to earn $550, and how much volunteer or other activity requirement, how much does that leave? We don't know. That's one of the things that are going to be explored as well. Are volunteer or other programs going to be valued at the same rate as our minimum wage? We don't know. That's one of the things that are still yet to come out. But in terms of the requirement itself, we know that it's just that $580 a month in verified income. Again, we don't know what verified income means, but this is information that I'm able to share right now. And in terms of who is affected, we've created this flow chart. And then also this is to say that we're going to be releasing information soon, handouts, other committee information that members should be able to use in order to kind of navigate these requirements. We are going to be releasing those. They're not full, they haven't been fully community tested yet, but we are working on them. And if you certainly have other questions, please feel free to connect with me. I can certainly answer your questions. But these are just some of the categories that are going to be affected by this change, and like some of the exceptions as well. And could you remind me, do we go until 11 for the time?
Yeah.
Okay, so I'm just going to rush through these next slides. In terms of medical frailty exceptions, individuals who are considered to be medically frail will be exempt from these requirements. These are just some of the categories here. They're not fully comprehensive. For the most part, if the state has enough information to determine whether someone meets the qualification to be medically frail, they should automatically be reflected on their OSHP application. If not, the state will be requesting for the member to provide some kind of verification, likely in the form of a doctor's note. And again, where you haven't decided what that's going to look like. And then more frequent renewals are going to be coming for most individuals. Right now, most individuals renew every 1 to 2 years. Most members are going to be renewing every 6 months. And in the following slide, I just have a breakdown of the populations that are going to be affected by that change. I know I just kind of rushed through this. Again, it's a lot of information. It's really high level. We are taking requests to just for organizations that want to learn more about this. And certainly we could carve out some time more individually in the future, one-on-one with the organization if you'd like to learn more.
Awesome. And I think at this point, if anybody has any questions, feel free to shout them out.
No, it's fine. Okay.
Sharing, thank you everyone for letting us present and share with you all today. You're all very important organizations. And again, I'm going to share my contact in the chat. If anyone would like to connect it and kind of learn more. We're putting together kind of like a lister right now, or just like organizations that are interested. Instead of meeting directly one-on-one, we're kind of going to be like leveraging a larger community forum where we can discuss the changes more in depth.
Awesome. Thank you so much, Abraham. And if you could send me your slide deck afterwards, I'd really appreciate that too. We had a request, but I upload that. Well, yeah, so big changes coming, and grateful to Abraham and HealthShare for being kind of that source of education and truth. I know that this will impact a lot of folks, and I don't know if everybody knows about them. So definitely, if you're just learning about this for the first time and you think of somebody that you work with that could use this information, please spread the word. And I really appreciate all of you once again for being here today. As promised, I'll upload this presentation and I'll hang out here for a few more minutes if there are any questions. But other than that, I hope you all have a wonderful rest of your day.
Just a quick question for Abraham. The community forum that you talked about, that email that you just shared, is that the best contact to get in on that?
Yes. Yeah.
Okay.
Right now, you could just email me expressing your interest, and I will take note of that and your email, or the best contact if that's not yourself and you would like someone else to join. And then we're going to be sharing more information as we actually prepare those spaces, likely coming towards the end of the month.
Okay, yeah, we have, with approximately 40% of our clients on OHP and mental health, this is a very tricky space for us. So just trying to make sure we have all the info we can. Thank you.
Yeah, thank you. All right, thank you, everyone. I'll follow up with the slides, and then, please contact me if you would like.